Hi, I'm Steve Adubato, folks, and it's our honor to welcome Dena Mottola Jaborska, who is Associate Director of New Jersey Citizen Action. Good to see you, Dena.
Good to see you too. How are you?
We'll put up the website for New Jersey Citizen Action. Tell everyone what the organization is.
Yeah, we're a statewide coalition and grassroots organization that works for social, racial, and economic equality for all.
In 2022, what would you say the 2 or 3 most pressing issues are for the folks you are most concerned about, those who are, in all candor, beginning the shaft for way too long?
That's right. So we represent low and moderate income New Jerseyans. That's about half the people living in our state. And our concerns for them have a lot to do with how we're all recovering from the pandemic, the economic impact of the pandemic, and how well people are getting back to work and being able to, fulfill their economic security for their families. So that takes in a lot of different issues, but that's our overall concern.
Dena, let me play devil's advocate, if you will. Okay, we're taping several weeks after the 2021 election, be seen in 2022. So one of the things that people say, some people, I hate when people say some people say, there are people who say this, that one of the messages is Phil Murphy too far to the left, the Democrats too far to the left, the progressive agenda leans too far to the left. We need to get more back to the center. There are many who perceive New Jersey Citizen Action organization, I know well, as a progressive left organization. So is one of the messages you get, I promise there's a question here, that most New Jerseyans, most Americans don't want what you want?
Yeah, well, in this past election, more Democratic voters voted than in the election before. So I think that the accomplishments that the governor and the legislature delivered for working families definitely brought out more voters and definitely showed that those policies, that the public and the people we represent continue to want those policies, those types of policies to be adopted and moved forward. There was another effect in this election, as you well know, Steve, which is that the right wing or the Republican base voters, which are pretty far to the right, people who are anti-vax and anti-mask, came out in even greater numbers, and they were very motivated and mobilized by these issues, which they're pretty deeply emotional about. So there were a variety of things happening in this last election, and it is really kind of lazy to assume that the result is that that the public doesn't want the legislature and the governor to adopt policies that help working families. I think that's really an oversimplification, not at all actually what happened. I think those issues, those economic issues that they delivered on, they poll really high. People really like them.
Define economic justice.
Economic justice could be anything from fair wages or living wages so that a person doesn't have to work 3 jobs to support their family. It could also be equal pay, so fairness against discrimination, so men and women make the same amount. White people, Black people, brown people are nobody's being discriminated on their race. So those are some of the aspects of economic justice. There are many.
But there's so much pushback, not just in New Jersey, but across the nation, about, hey, let me play this devil. I keep saying I play devil's advocate. All I'm really trying to do is make an argument that others make. You know, these undocumented immigrants, we don't even have enough to take care of our own people, right? Those who did it the right way. What do you say to those folks?
Yeah, I mean, we have a dearth of jobs right now. Companies are desperate to hire. We certainly need people at all income levels to take those jobs. We need people in all walks of life to take those jobs, including immigrants. We do have enough. We have enough to meet their needs. Immigrants are largely cut out of the public benefit system anyway. So I'm not even really sure what that argument is actually about, whether it's about jobs or public benefits. But for the most part, immigrants are not eligible for, public benefits.
COVID has laid bare a whole range of racial and social issues of inequities, or issues of social and racial inequities in underserved communities. What are the worst aspects of that, Dena?
Yeah, I think, one aspect is we just talked about immigrants were really largely left behind. They didn't receive stimulus checks, unemployment, and that was a substantial challenge for undocumented immigrant families in this country who really couldn't find work because so much was closed and really struggled. Also, essential workers, so all kinds of people who continued to have to go back to work during the pandemic. I think, they just contracted COVID at higher rates. And so mostly lower earning families who were working in essential, the majority working in, were low income and essential work, really got sicker, higher death rate among that population. So that was one of the inequities that we do have to face. Healthcare was a big challenge for people who lost work, especially in a pandemic. Everybody needed healthcare to, for example, get tested, to get the vaccination. Ultimately, the government made decisions to make sure that people could access all those services for free. But at the beginning, it was unclear how do I get tested if I don't have health insurance, or how do I get care if I'm sick with COVID? It took the government a little while to act to fill that void.
Dena, mental health, 2022, the Murphy agenda, which has to be measured against what the state legislature does. And excuse me, we have leaders from the state legislature joining us to talk about the relationship with the governor and policy issues that are a priority in 2022. One issue, one area that that the governor, together with the legislature, they need to take real action on based on the agenda that you and the other folks at Citizen Action care about. What is it?
I think, a lot of what we're working on deals very, very squarely with acknowledging that racism exists and has had an effect on our state and has led to, in the country, and has led to the racial wealth gap. And so a lot of what we're working on is to really close the racial wealth gap. To that end, we're still working to expand coverage for people. We still have a substantial number of people uninsured here in the state. Not just undocumented people, but low-income people who can't afford Affordable Care Act plans. So we're still working on that. That's still, on the agenda for 2022. We're still working on things like who pays more in the marketplace for important services like car insurance. Black and brown people pay way more. And why is that? So we're still working, dissecting that issue, looking for solutions there. We're still working on policing and the unfair disproportionate impact of unfair policing practices on people of color.
But before I let you go, before I let you go, you do not support, or do you support, quote, defunding the police?
No, we've never supported defunding the police. That's
just clarifying that.
Yes, sir.
Yeah, listen, I know it's a complex issue, and we've covered it. Look at our website around a whole range of programming we've done in that area. Dena, I'm sorry for cutting you off. We'll have you back again. Just as always, we're managing time. But we thank you and wish the team at New Jersey Citizen Action all the best. Thank you.
Thanks for having me. Thank you. Bye-bye.
You got it. Stay with us. We'll be right back.
I'm very grateful that I'm still here.
That's me and my donor when we went to celebrate our first anniversary.
With a new kidney, I have strength.
They gave me a new lease on life.
I'm still going everywhere and exploring new places.
Nobody thought I was going to be here. Nobody.
And I look forward to getting older with my wife. That's possible now.
We're transforming lives through innovative kidney treatments, living donor programs, and world-renowned care at 2 of New Jersey's premier hospitals.
They gave me my normal life back. It's a blessing.
RWJ Barnabas Health. Let's be healthy together.
Also brought to you by Valley Bank, Englewood Health, the Turrell Fund, supporting Reimagine Childcare, the Robert Wood Johnson Foundation, Johnson & Johnson, the Fidelco Group, New Jersey Institute of Technology, NJIT makes industry-ready professionals in all STEM fields. PSE&G, committed to providing safe, reliable energy now and in the future. And by MD Advantage Insurance Company.